Welcome to Your Capital What's Up. I'm Chuck Wiger, your area state senator. Thank you very much for watching. Today we're going to talk about something very important to each of us, our health. As former state senator Jerry Hughes used to say, your health is your wealth. And one organization that does a great deal to address this is HealthEast. Joining me today is Vice President at HealthEast for Specialty Physicians, Les Stern. Welcome to our show, Les.
Thank you for having me.
Now, you've been with HealthEast for about 5 years in your role in working with physicians, and particularly we're going to talk about cancer care. And HealthEast has rolled out some additional programs to address cancer at Woodwinds Hospital in Woodbury, and of course at St. John's in Maplewood. There's been an excellent program. But tell us about what's new at Woodwinds, and then we'll talk about St. John's as well, and what's available for cancer care as it may affect anyone that may be watching or their families. Particularly when you get that call or when you find out you want to do the most that you can for your family, and you've put a great deal of time into this. So tell us about what's going on at Woodwinds right now.
Sure, I'd be happy to. We, in October, opened a new cancer center at Woodbury and the Woodwinds Health Campus. And the things that we brought to the Woodwinds campus were medical oncology services. And by that I mean having on-site medical oncology physician providers that are able to see patients on an outpatient basis right in their community. In addition to that, we've expanded with our chemo infusion department, meaning we can develop care plans for the patients that our medical oncologists see and deliver and offer a more comprehensive chemotherapy experience to them. It's been a really nice partnership with the Woodwinds Health Campus in that the integrative therapies that are delivered on that campus and have been part of the Woodwinds campus indefinitely fit very nicely with the oncology patient population. We have in the clinic setting integrative therapies such as healing touch, acupuncture, nutrition services, genetic counseling, etc. So at the Woodwinds campus, we're looking at patients across the continuum to try and meet their entire need as opposed to only their medical need.
Right, and it's very important to take that approach. And we have a testimonial that was done on a patient, and it's with her permission that we're going to share that. A number of public officials were out at the Woodbury at Woodwinds to learn more about your program. And would you like to introduce the DVD video we're going to watch right now?
I will. We have a grateful patient who was diagnosed with cancer, and she sought to receive services in our cancer care center. She tells a little bit about the experience that she went through what is a very difficult time, and she talks about some of the differences in how we approach care for the patients, and we really work hard to navigate that patient through the healthcare system, which can be very complex, not only addressing her medical needs, but also making sure that support is provided, that her family's well taken care of, that folks are very well informed of what's happening, and she's kind enough to share the story about why that experience was a positive one for her, and that the way we approached her care was one that resonated with her and her family.
Thank you for that introduction, and please join us in watching this special video.
My room became this safe haven place where in the afternoons the sun would come in, and it would be a place where I would put music on and think about my mom and think about what I was going through, and it just was a place to rejuvenate me a little bit, just a place where I could find comfort. I just went in for my routine mammogram. I was actually not going to go in because of work. I remember that day I was working at home, and I was like, you know, I really have so much to do. I really shouldn't ignore this, but all right, I'm gonna just go and do it. And they called me back the next day and said that they saw a suspicious area, that they would just like me to come in. What hit me most was that my mom had just died 6 months earlier, so that November before that year, with breast cancer. Come to find out that there was a tumor hiding behind the microcalcifications. so tiny that the mammogram didn't pick it up. So I'm so thankful that the radiologist, I actually wanted to get his name and send him a thank you card, because he truly took the time to dig a little deeper and save my life of what my life would have otherwise been. So it was just another example of how compassionate and caring and comforting everybody that I touched in that kind of surround sound of care from HealthEast.
2 years, almost to the day of her mom's passing, Noreen learned she was cancer-free. It was also her birthday, and she believes this was her mom's gift to her.
So I looked at this way as a gift, that she wasn't with me at my birthday 3 years ago, but that she was with me at my birthday from last year, saying, here's another chance. Here's the rest of your life. She gave me life the first time, and I really truly believe that her spirit, she gave me life the second time, because that little voice that pushed me to go to get that mammogram was her.
Welcome back to our show. I'm Chuck Wiger, your area state senator. I'm joined with Les Stern from HealthEast. Thanks for sharing that video, that very moving testimonial. And I'm sure there's many more that have a similar story that they could share.
There are. We have a nice group. Not all of our patients are, of course, filmed on video, but we have a lot of feedback, and we solicit a lot of feedback from patients about their experience and what was positive from them and what we can improve upon. We find that cancer and oncology patients are very engaged and interested in the care that we offer. Cancer is becoming more of a chronic disease. Patients are living longer after being diagnosed with cancer. So we have a focus on the screening process to figure out how do we care for patients earlier and get them into the right treatment protocols. But in addition, the survivorship aspect of it. So after you've been through an experience like that, what can we do to support you long term to make sure that you're comfortable with how your follow-up care is being delivered, and more importantly, some of the emotional support that we can provide and connect those folks together to be able to tell their story and share in that experience.
And HealthEast is involved in the whole continuum, starting at prevention and a number of programs that you have in outreach. But if there is a diagnosis, there needs to be that intervention. Give us an idea as to how prevalent cancer is.
Cancer is growing drastically in this market, and I think a lot of that has to do with early detection. We're documenting seeing more and more cancer, especially in the Minnesota market. It's become one of the leading causes of death, surpassing heart care. And I think the reason of that is we're now picking up at an earlier phase. We're identifying more patients with cancer and providing that treatment, but unfortunately the outcome isn't always that we want it to be. Our decision to expand from our offerings on the St. John's campus, where the cancer center is, out into the Woodbury market, is the Woodbury market has an extremely fast growth rate of diagnosed cancer. About 25% of our entire population that we care for in HealthEast is in the market in Woodbury. So it was a natural fit for us to be able to move our services out to the market so patients wouldn't have to drive to access that care.
And you coordinate Maplewood, Woodbury, the whole East Metro market, if you will, as well as your other facilities.
Correct. It was very important when we implemented our integrated cancer program 5 years ago that we took the learnings from that program and were able to take those into the Woodbury market. So it wasn't a new startup clinic. When we talk about having a new operation in Woodbury, we have 5 years of very significant learnings that we've had in the evolution of how care is delivered, and we're able to bring experienced staff. We brought nurses that had worked in the St. John's Cancer Center, we brought physicians that had worked in that center, and other staff, and coupled those with the Woodbury staff on the Woodwinds Health Campus to be able to have an offering that we think is unique.
We were very impressed with the commitment, with the facility, but it's mostly the people, the personnel, the human touch that they put with the high-tech strategy incorporated with the holistic approach you take. So we know that it's being well received, and hopefully this will help reach out to others too that may not be aware of it. Now, tell us about your role. And you're an administrator, and you've been trained with a master's in business, I believe. Was it University of St. Thomas?
Correct.
And so tell us about the training that's involved for your position, and then what you do ultimately that's going to help the physicians and the whole healthcare team in serving patients. Your role in putting it all together.
Sure. My undergraduate degree was in healthcare management, so a focus on the business side of healthcare. And we have a philosophy of a dyad partnership. So we have our medical director, Dr. Puneet Chima, who's a medical oncologist.
A dyad partner, okay.
Correct, a dyad partnership. Dr. Puneet Chima is a medical oncologist, and he is my partner. We work very closely together to focus on things like having the right providers, focused on quality, the correct staff, the right quality indicators to make sure that the care we're delivering is meeting the expectations of the patients.
In fact, let's say someone watching was just diagnosed with cancer, or has a loved one or a friend that's just diagnosed with cancer. Now what, and how does that intersect with your system?
Yeah, great question. We have a care navigation model that we very aggressively started when Dr. Chima and I came to HealthEast 5 years ago.
Okay.
Care navigation is a group of nurses who have worked in the oncology field that they do the initial, they have the initial contact with the patient.
Okay.
When they have that,
That's called the care
navigation.
Navigation.
Correct.
Okay.
So when that patient has contact with the care navigator is not only focusing on what the medical needs are of the patient, but also financial needs, any barriers to receiving care. They're focusing on other services, genetics, psychotherapy, et cetera, that would be of benefit to the patient. And they're really looking at it from a very holistic approach.
Because what's going through their mind, and am I going to live? Am I financially ruined? What's next? And
Right.
so this navigation team is exploring all those avenues.
Correct. In addition to that, coordinating the care between a very complex group of specialty physicians. And not only do you have medical oncology, there's radiation oncology, pathology, laboratory, blood work, x-rays, imaging, surgical procedures, etc. So with those physicians operating in different areas, that navigator makes sure that the patient is clear on what information one doctor's passing to the other, and that the physicians are well coordinated to make sure the work that they're doing gets to the other physicians.
So is there one person that you primarily work with? This is the patient now. Or maybe someone in the family that's helping in this process. They call this navigator, and how long does this take?
They contact the navigator. The navigator is their primary contact. They, of course, work with many different people in the program, nurses, et cetera.
But you've got to contact.
But that navigator is the go-to person. If the patient is confused about what they heard during the appointment, if they don't know when the next appointment is, the navigator is the one that helps them through that. Not only reactively, but proactively. If the navigator thinks the patient would benefit from learning a piece of information, that navigator reaches out and provides that detail.
Okay. And then next steps.
After the navigation process, the initial intake, as we call it, or identifying what the next steps are for that patient, generally the medical oncologist will be the first person to have contact with that patient. Okay. They will develop a plan of care. They do an initial visit, develop a plan of care. The navigator then is right along the patient's side to determine what the next steps are. Could be chemotherapy, could be radiation, could be a surgical procedure. So it goes in a couple of different ways, but the navigator makes sure that they get to the right spot. Okay. And after that immediate care is delivered, then what's next after that, and how to move that patient through the system.
And the finances. People are going to be worried. Will my insurance cover it? Maybe they don't have insurance, or the cap is going to bust. What about this realistic part as to whether a person can afford it?
Yeah, we have financial counselors in the program that are very early on working with the patients to alleviate any financial concerns that they have. Obviously, when they're dealing with such an important issue in their life, our focus for them is to get better. We want them to worry about getting better in the clinical care and the things they're going to go through. So at HealthEast, as a nonprofit health system, we care for patients regardless of their ability to pay. We almost...
State that again. Regardless of their ability to pay. So if you don't have insurance, but you have cancer, you need help, you're going to...
We will care
still
for that
provide.
patient based on the best clinical care. We don't make decisions about the treatments. We don't make decisions about what drug they may get, regardless of the cost of that drug. The physicians are very focused in developing the right care plan, regardless of what their insurance or their payer source is. On the other side, what our financial counselors will do is identify different programs or assistance opportunities for them so that they're not in a position after they get through this process that they're financially burdened in a way that causes them anxiety. There are many programs via pharmaceutical companies, via the American Cancer Society and others that we can introduce the patients to those programs to provide help. If the patient is not in a position to be able to think through that process because they're worried about the condition that they have, then our counselors will aid other family members to do that. But patients are cared for. We separate the physician delivering the care from the business aspect of other folks helping that patient identify a way to support the funding of that care.
You do?
We do.
Okay. And people then don't necessarily face bankruptcy then at all. That can be totally avoided.
Yes, it would be being in the system and identifying a way to find an alternative funding source for them.
Okay.
It does alleviate some of that pressure.
Okay, well, that certainly helps.
It does.
And then getting the best treatment overall that you can, and you're state of the art.
We are. We have many devices for treatment that we were the first in the state of Minnesota to offer. An example of that is high-dose brachytherapy.
Say that one more time.
High-dose brachytherapy.
Okay.
And in that, we have used that for the treatment of breast cancer. The traditional care for breast cancer patients was to receive radiation over about a 35-day period. Come every day for 35 days. High-dose radiation allows that patient to be cared for in 3 days. So it greatly reduces the impact to the person's life, get back to work quicker, get back to things that occupy a person's time outside of being cared for cancer, and offers a very accurate, precise dose of radiation that goes to that patient for treatment. That's one example of technology that we have that's unique in the Twin Cities.
Okay. It costs a lot of money for these for the equipment, and at the same time, if it's about saving your life, and if there's the capacity, I guess we're going to do what we can.
Right. We, being part of a large health system, we are probably not as profitable as what some of the other private groups may be, but we have had a significant commitment. As I mentioned, I've been with HealthEast for 5 years and worked in other health systems in town. I've never seen a commitment like the one that HealthEast has to do the absolute right thing for the patient, to put in the correct technology, to make sure the space is appropriate, to have the appropriate staff. And that's based on delivering the right care. That we feel if we have a combination of high patient satisfaction with high quality, that will be a winning combination to doing the right thing for the patient and for the system.
Okay. Do you have a vision 5 years out, or maybe 10 years out, as to where HealthEast will be in its treatment for oncology patients?
We do. We have a vision that as we've started our integrated program on the St. John's campus, as we've talked about, we've now gone out into the Woodbury campus, that we want to become a regional provider, that if a patient unfortunately is diagnosed with cancer, that they identify and resonate with the way that we're delivering that care, that we become the destination center for them. That we have enough access points delivering the full spectrum of services, that geographic barriers aren't a problem for that patient to be able to get to HealthEast, and that they can understand why we're doing something different in the care of cancer patients.
Okay. And there's lots of discussion at the federal level, at the state level, in terms of regulations, rules, requirements, in terms of equipment. Any points about that, as I know you're involved here at the state capitol as well?
Yes. One of the challenges that we face right now is with radiation facilities, so the delivery of radiation care delivered by a linear accelerator. A few years ago, there was a moratorium put in place to not put any more linear accelerators into the market.
How much do these machines, the linear accelerators cost?
They're a little better than $1 million to put a linear accelerator in place.
And the policy intent, I believe, was that's a lot of money, and put a cap on how many we have, thinking that can help control the utilization so that we're not going to have as much expenditure in healthcare. But what is your prescription as to what we should do with the law?
Yeah, and I think that's a good summary. At the time the legislation was put in place, there was capacity with the number of linear accelerators that we had in the Twin Cities area. So as opposed to growing and having more linear accelerators, how do we use them as efficiently as possible? We have the benefit right now on our St. John's campus. We have 2 linear accelerators, one that is more recently installed and one that is aging. And we're at a point where we have to make a decision about replacing the aging linear accelerator.
How long does it last?
The one that I'm talking about is about 10 years old.
Okay.
Technology has advanced so much. Some linear accelerators used to last for up to 20 years. The introduction with new technology around linear accelerators has shortened that lifespan to be able to deliver the most effective care for the patient.
Okay.
So having these 2 machines, we're faced with a decision right now where we'll need to replace the second machine.
Okay.
Our program has grown, we're getting to capacity, and we need to consider doing that.
And you have to have the machine to make the diagnosis and monitor the progress.
And provide appropriate treatments. So our point is that we don't want to add capacity to the system. We need to replace one of our current machines. So a way to honor the moratorium that's in place is to take the machine we have, replace it, which we would do anyway, but replace it in a place that delivers care closer to patients, which is in Woodbury in this example. So it doesn't increase the capacity across the Twin Cities, it simply relocates it to a place where patients wouldn't have to drive.
Okay. Well, on a personal note, you were raised in Illinois, I believe?
I was.
Okay, and how did you eventually make it up here to Minnesota?
Yeah, I relocated to Minnesota in 1995, and a large reason for that was the wonderful health care that we're delivering here.
Really?
I had relocated. I had no immediate family that was living in the area, but I appreciated the uniqueness and the advancement in health care that we were seeing in this market. In addition, it's a beautiful area. It has many things to offer, having a family at that point, a young family, and wanting to take advantage of that as well. And once I got here, there was no question that the work we were doing in healthcare in Minnesota was unlike any in the other part of the United States. So it was something that I wanted to be a part of, being innovative and unique and cutting edge, and knowing that if patients were coming to our facility, I have a philosophy that if I wouldn't care for my family in the facility that I'm delivering care at, I don't want to work in that facility. I need to look at the patients that are in the lobby. My office is located right off the patient lobby, intentionally. And every day when I walk into my office or I come out of my office, I'm interacting with the patients that are receiving care, and I can ask them, how's it going? In a very difficult time.
And you do that?
Often,
Good.
daily. And that's my ability to really understand and think about the work that we're doing for the patients that we're delivering care for.
Great. Well, we're happy you made the move to Minnesota, got the great education at the University of St. Thomas, and are making a very nice contribution to our area in helping families faced with cancer. And as our viewers know, that could be any one of us. You never know what's ahead. So we appreciate the efforts that are being done by HealthEast. And if anyone has questions about the program, I know you've got a great website, but any suggestions, look at the website, contact you, or?
Absolutely. We do have a website, which is healtheast.org.
Yes.
On the healtheast.org website, there's a specific area to oncology care and cancer care and the work that we're doing, whether it's for a family, whether it's for information finding, or to access any of these other services.
Lots of great health information too, and prevention and tips where you can ask questions. Yes.
Screenings. And I should make note that the programs that we offer around genetics and others are open to patients being cared for in other areas. We do care for patients that don't receive their immediate medical care within HealthEast. So if you're currently receiving treatment, there may be some programs that we can help you take advantage of.
Les Stern, Vice President at HealthEast, Specialty Physicians, thank you for joining our show, and I encourage our viewers to contact you, learn more about the program.
Thank you for having me.
And viewers, if there's questions that you have for Les or anyone on the team at HealthEast, please give them a call or check out the website and follow up. I know you'll get the attention that you're looking for. If you have questions of me, my number, my cell phone, 770-0283, or give me a call at Capitol, 296-6820. Remember, your health is your wealth. I'm Chuck Wiger. Thank you very much for watching.